Hi there, I'm Dr. Kathleen Young. I'm a child, adolescent, and adult psychiatrist. And more importantly, I'm a mom to a child on the autism spectrum, which has been one of the main reasons I've taken a special interest in autism spectrum disorder, or ASD, and done a lot of research on it. And as I've learned more about ASD, I've come to realize that there's a huge portion of my clinical population who meet criteria for this diagnosis but have never been formally diagnosed. I think the latest study estimates about 20% of the clinical population in psychiatry is on the spectrum, but many of these patients are not being diagnosed because so many clinicians don't feel comfortable making the diagnosis. So there are a lot of people out there who are on the spectrum but don't know it. They know they're different, but they don't understand why. And that's what I'm going to be discussing with you. I'm going to talk about our current understanding of the diagnosis of autism spectrum disorder, why it's so often missed in clinical settings, and important gender differences in both ASD and ADHD, since there's a lot of overlap in those diagnoses. I really hope that you enjoy it and are as excited about it as I am.